Welcome. Good morning, everyone. Welcome. Bienvenidos. For those who want to continue in English, stay put. Las personas que desean escuchar la versión en español, por favor, elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. Gracias. We are thrilled you are here to engage in this exciting webinar about a multicultural orientation framework approach to addressing racial disparities in behavioral health care. I'm Dr. Tiffany O'Shaughnessy. I'm one of the hosts of our webinar today. First things first, a brief audio description of myself. I'm a white cisgender female, she, her pronouns, early 40s with reddish brown chin-length hair. I'm wearing a black top and my background is a mountain scene tapestry. I'd also like to acknowledge that SF State's campuses in San Francisco sit on the ancestral homeland of the Ramaytush Ohlone. We further acknowledge that we work on the ancestral lands and waters of many other Indigenous peoples and nations in our fieldwork in the Bay Area and around the world. We're committed to ensuring this webinar is accessible to our audiences. Closed captioning is available by clicking the closed captioning option at the bottom of your Zoom screen. If at any time your access needs are not met or become not met during the webinar, please send a chat directly to a host or co-host. Access is always a work in process, and so we appreciate your comments, feedback, and support. I am a faculty member in the Department of Counseling, Marriage and Family Therapy program here at SF State and co-investigator of this project. I'm working alongside my project primary investigator, Dr. Julie Cronister, who is faculty and coordinator of our clinical mental health counseling program, and my co-investigator, Dr. Molly Streer, faculty in our school counseling program. I would also like to thank our graduate assistant, Chinue Igwe, who is working hard to stay on top of the technical issues, chat boxes, etc. today. This is our 5th of 10 webinars sponsored by our Equity and Justice Focus Integrated Behavioral Health Counselor Training Project, which is fully funded by the Department of Health and Human Services, Health Resources and Services Administration, as part of an award totaling $1.9 million. A couple of additional things before we begin. Because we're having Spanish translation, I'm doing my best to speak slowly, and I'll remind all of our speakers today to try to do the same for simultaneous translation in the Spanish room. If you are one of our HRSA stipend recipients or are interested in receiving continuing education units for your attendance today, please pay close attention to the announcements provided in the chat for sign-in and evaluation links. This is a reminder that this is a live recorded Zoom webinar, therefore the audience is not visible and the audience cannot turn on their video or audio. The chat function should be available for comment, sharing of resources, supportive emojis, etc. To ask the presenter a specific question, please post your question in the Q&A function. The Q&A will occur during the last 10 minutes of the webinar, so please post your questions as they emerge and the presenter will answer questions at the end. If we cannot get to all of the questions, please contact the presenter directly. Her information will be posted in the chat. And so now it is with great pleasure that I introduce today's presenter to you, Dr. Karen Tao. Dr. Karen Tao is an associate professor in counseling and counseling psychology in the Department of Educational Psychology at the University of Utah. She also directs the Clinical Mental Health Counseling Program, Master's Program. Karen's clinical and research interests are guided by an overarching goal to reduce disparities in the access, service, and quality of mental health and education for historically marginalized groups. She is interested in the questions: how do people negotiate conversations about difference and culture? And why does multicultural competence matter? Karen has over a decade of experience providing diversity and social justice-oriented training for public and private schools, nonprofit and private sector organizations and universities. Most recently, she collaborated with PBS Utah to produce a digital series called Let's Talk. As the host of the series, Karen met with parents to discuss how to talk with kids about race, racism, and cultural differences. Thank you for joining us today, Dr. Tao. Please go ahead and take it away.
Good morning. It is so good to be here, and I want to thank you all for having me be a presenter on this project. I am zooming in today from the University of Utah, where I am a faculty member, and I'd like to read a land acknowledgement before we begin. We acknowledge that this land, which is named for the Ute tribe, is a traditional and ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many Indigenous peoples and their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. So I'm really grateful to be here today. So many of you are wondering, what are we going to be talking about? And so I'd like to share a bit of a roadmap. We have an hour to spend, and my hope is that we are able to really delve into this framework of multicultural orientation. I'll start with an intention, followed by a description of what multicultural orientation is, why it matters, talking a little bit about the evidence and research around MCO. And then what I'm hoping we can do is, I know that this format doesn't always allow for interaction, but we do have the chat function. And so I'm very excited for folks to be able to chat and send in their sort of ideas about this framework. And then I'll save a little bit of time for us to have some question and answer. So let's begin. I invite you to think about a time when you learn something new about a patient, client, or a friend. Something new that you thought you knew very well, and you were surprised by what you learned. How did it feel to learn this new piece of information? How did this influence your subsequent interactions or change your relationship with someone that you thought you knew very well? And what did you learn about yourself? So I invite you to call to mind and heart this person as a touchstone for our time together today. What I found over the years of just being a human and a learner is that when we can envision or touch in with someone that has touched us in some way, it helps the learning sink in a little bit deeper and reminds us of why we're doing what we're doing. So we're living in a current time in which many of you are likely feeling pretty tired, pretty overwhelmed. We've been in a 2+ year of a global pandemic, and within the United States, in particular, faced with another social pandemic, really sort of at a point of moral reckoning, trying to figure out kind of how to talk and how to be with folks who may not share the same ideals, values, sensibilities that we do. And that we're in an era of real divisiveness in many of the contexts in which we live and work. And so what do we do? How do we be? And so as I myself have been grappling with kind of how do I engage in conversations that are really hard, conversations about race and racism, political conversations, I felt like I needed some sort of grounding around what that might look like. And so many of my mentors and folks who have trained me as a practitioner have really instilled in me this idea that it does take a lot of interpersonal grit. And so the concept that I have been kind of wrestling with and thinking a lot about is cultural fortitude. And this hopefully will ground us in our discussion today as well. And I define cultural fortitude as the mental, emotional, and interpersonal strength in the face of cultural discomfort and pain that sparks courage to move toward racial and cultural repair and healing. And so this concept for me really, I think, cuts across various contexts, whether it's personal or professional, with clients, with students, with supervisors, supervisees. And so I am curious to hear how cultural fortitude might be showing up in your life as we move forward today. One way in which cultural fortitude can start to be sort of cultivated is through what many of you are familiar with, multicultural competence and multicultural orientation. These are two frameworks, and I'll be talking more about multicultural orientation today as a framework for building cultural fortitude. But I wanted to sort of juxtapose these two frameworks together. Multicultural competence is one that many of you are familiar with. I was fortunate enough to be trained in a field in which multicultural competence was defined really broadly as the knowledge, skills, and awareness that providers develop and hone throughout their professional lifetime, and being able to work with folks from both similar and diverse backgrounds from themselves. And today I'll be focusing on multicultural orientation, which the way that I and my colleagues think about it is, whereas multicultural competence is kind of what we do in the room, what we do in a group or a behavioral health setting, multicultural orientation is how we are. I know that sounds really sort of amorphous at this point, but I will be breaking it down in just a minute. So how we are and what we do. And what we have found so far, this is just a little preview of what we know in the research and literature, is that behavioral health outcomes are very much influenced by providers' multicultural competence, the knowledge, skills, and awareness they have in working with folks who are culturally different from themselves or sometimes culturally similar. And behavioral health outcomes are also very much influenced by multicultural orientation. And the three pillars that I will be sharing, talking about that make up the multicultural orientation framework are cultural opportunity, cultural comfort, and cultural humility. So for many of you who are providers and researchers and students and all of us in the room today, we are multicultural beings. And there are so many parts of who we are that are in the foreground or sometimes background of our interactions with our clients, with our students, with our supervisees. And so here's a visual of just some of the various intersecting identities that come into the room. And so when we think about multicultural competence and multicultural orientation, it can be really overwhelming to think about all of the varying identities that could be playing a role in our interactions. So for example, today I was chatting with Dr. O'Shaughnessy in the beginning and saying, I'm in my office today and I've been at home for a really, really long time. And so when I have been working from home and teaching from home, a lot of my identity as a parent is really at the foreground because it's the context in which I'm kind of working in. And as soon as I walked in here, my professional faculty sort of identity came to the foreground. And so I felt different. And so this is just one example, that immediate shift of how much identity and our social identities and who we are shifts across contexts. And multicultural orientation is really sort of focused on that fluidity of social identities and how it shows up in our work with patients and clients. So broadly, multicultural orientation is how we as providers create a healing context where our patients and clients can be their full cultural selves. MCO, as affectionately known, is also about recognizing our behavioral, affective, relational, and somatic responses to every interaction. I know that's a lot. And I'll talk about how that shows up in each of these pillars. Another major sort of tenet or intention around multicultural orientation is about how we make the implicit explicit, how we consider the frame, and also how we stay present. To put specific questions to each of these pillars, with cultural humility, questions like, what else is important to learn? Why am I drawn to this aspect of the client's narrative? Cultural opportunity, questions like, what aspects of the patient's cultural identities are salient and how might this be further important to explore? And with cultural comfort, what am I noticing in my body? What am I doing or what am I not doing as I work with this client, and how come? In the box in the top right, while we are sort of asking these questions and these three pillars are operating within our interactions, so much of our learning and so much of the way in which we engage with each other is multifaceted. So in a lot of educational contexts and a lot of medical and health contexts, we often rely on our cognitive skills. Like, what are we thinking? The cognition. But what's underlying all of that sort of cognitive work is also emotion, behavior. What are we doing, not doing? Our physiological reactions, and also our relationships. And so multicultural orientation embodies these three pillars, which I'll talk about next, and also really illuminates this idea that we are taking in each other emotionally, cognitively, behaviorally, physiologically, and relationally. So a lot is going on in every interaction. So let's talk about the three pillars. So cultural humility has been talked about for quite a while in behavioral health, in psychology, in multicultural psychology. And my colleagues and I really, really appreciate how cultural humility really captures this idea of how we are with each other. And we define it as an other-oriented stance. So the focus being on less on us, more on the other, with a sense of openness and curiosity and authentic investment in someone else. So with cultural humility, sometimes we think about the term humility as being a complete sort of taking us out of the equation, but we really want to sort of emphasize that it's important to have a clear view of who you are as a provider. So it's not the sense of neutrality where I'm not focused on me at all. I'm a blank slate, and let's focus on the patient. But it's the sense that I am open to learning something new, that there's much more that I can learn, that every interaction is a new interaction. So for folks who are veterans in the field of behavioral health, you have seen a lot and you have worked with patients who might have similar presenting issues. And so one way that cultural humility shows up is, oh yes, I'm familiar with this presenting issue. I've worked with folks who have brought in this problem before. Some of the questions that we might ask to elicit some cultural humility are things like, what's new this time? How am I different this time? What am I noticing? What about this particular client might be giving me new information? So cultural humility is the first pillar. The next pillar of multicultural orientation is cultural opportunity. And these are those moments in your work with someone where they bring up an aspect of their cultural identity or social identity and offer opportunities to enhance the dialogue. And so The role of a provider who leverages cultural opportunity is to really notice those moments, and they might come in sort of implicit, sometimes explicit ways. And the next three bullet points below are things that we might even say, like, let's explore you. And seems like this might be hard to talk about and something we might want to delve into more. And I want to underscore that this is when clients or patients bring in aspects of their social or cultural identities. So it's an opportunity to learn more about their intersecting selves, to learn more about their background, to learn a little bit more about how self in relation might be playing a role in the presenting issue that they bring up in sessions with you. The third pillar is cultural comfort. And we define cultural comfort as those thoughts and feelings and somatic reactions that come up before, during, and after conversations with clients. And cultural conversations are those that elicit aspects of our identities as providers, our clients' social identities, and how are we responding to them? Is there a degree of ease or openness and calmness as we discuss things that might be a little bit more tricky for a client to talk about? Or maybe as providers, we have had less opportunity or practice to talk about things like racism, sexism, transphobia, religion. And how are we engaging in that conversation? We're also paying attention to discomfort. And this is also important to sit with, to notice how discomfort manifests. For me, discomfort often manifests as a lot of nodding. And it's almost a self-soothing thing that I think I'm doing because I'm really uncomfortable with what we're talking about. And so I keep nodding. I've been called the bobblehead in previous training. Or it could be the shaking of the foot. Sometimes discomfort can show up as moving into psychoeducation and taking it from the deep, more emotional work that maybe we're focused on to bringing it up to more cognitive levels. But in your chat, I am curious just for folks to just start naming where we feel it, where do you feel it in your body when a conversation about, let's say, social identities comes up, or a social issue comes up that we're having with our clients, or it doesn't even have to be with a client. Where do you feel it in your body? This is important for us to pay attention to. Great. Chest and stomach, in my chest, heart racing, that's me. Gut, stomach, heartbeat, eyes. Jose says eyes. A lot of chest. Shaking of the foot. Yep. Jaw, talking over my words. Thanks, Jane. My handshake. Face feels warm. Thank you. Eyebrows begin to fidget, shaking. Oh, yes, Laura, yes, voice getting tight or higher. Nothing like a good video recording to highlight those moments. Cracking knuckles. So thank you. Keep bringing those in because I invite you to name where it is in your body that sometimes discomfort lives, or maybe even not discomfort, but arousal might live. Oftentimes, especially in some settings, we are often encouraged to treat that as noise, to treat that as something that's annoying and an irritant or just an idiosyncratic thing. But from a multicultural orientation perspective, this is such important data. So your throat getting tighter, your voice getting higher, you're starting to ramble, your foot tapping, you're looking away or looking around. These are all important sources of data. And as humans, we often have these reactions first before they formulate into some kind of thought or question or awareness. And it's telling us, hey, something important is going on here. I might not know what to say right at this moment, but what the client's bringing up and how I'm responding to it, viscerally, somatically, emotionally, is important for me to pay attention to. And I might not necessarily respond or share that in that moment, but it's important for me to reflect on, and maybe in the next session, maybe 2 sessions down, I say, when we had that conversation, I noticed something in my body come up and I didn't really have the words to sort of articulate what I wanted to say, but I've been thinking about it. And when you talked about, your anxiety around talking about your sexuality, I really wanted to go there with you, and I realized I pulled back. And I wonder if maybe sometimes that happens for you with some friends. I wonder if you've been responded to in that way. So we use our awareness toward our cultural comfort also as important source of data. So cultural humility, cultural opportunity, and cultural comfort all go hand in hand. All right. Oops, there we go. And my colleagues and I and other scholars across the country have been doing some research around these pillars. And we have some evidence that indicates that when therapists are able to identify cultural opportunities and talk about them with their patients, with their clients, there are better therapy outcomes. I'm really simplifying this, and I have some of the references below, but I want to just give you a snapshot. In group settings, the group level cultural humility, so this is the group's openness and curiosity and willingness to explore other folks' identities, cultural identities, leads to the group's improvement as a whole. Similarly, when opportunities are missed in group settings to delve deeper into our clients' social backgrounds, their cultural identities, the group as a whole don't do as well. So there's this real collective impact. Similarly with cultural comfort, the more comfortable and more at ease we are talking about social issues, social identities, the more positive the outcomes for clients. And I also want to highlight the windows of opportunity. So my doctoral student, Amira, conducted this study, a qualitative study, and looked at the ways in which cultural opportunities show up. Often we have this belief that only when a client names specific identities or uses the words, that this is the time that maybe we want to explore a little bit further. But what she found is that there are so many entry points into how we can understand our clients a little bit more without directly naming a client's identities. It could be through talking about symptoms, where we ask things like, tell me a little bit about how you understand what these symptoms are. How are you formulating what's going on? And it's quite remarkable how much that opens up into a cultural opportunity to really understand maybe the stigma, maybe a cultural explanation for how certain symptoms are showing up. And so there are many windows of cultural opportunity in which we can really delve deeper into our clients' understanding of the presenting issue. I'd like to talk a little bit about this part that I mentioned called, what does considering the frame mean? So part of multicultural orientation is about noticing the frame. So we are going to do a short exercise, and again, enter into chat. I'm going to show you a picture. There will be a statement on top, and it will say, why do you think this? And without thinking too much, without taking too much time, I'd like you to just enter into chat your initial hypothesis. There are no right or wrong. These cows are sick. Why? Please enter into chat. Diet, the grass is full of pesticides. The food source, grass, food. They have diarrhea. They ate something not good for them, close to people's waste. Location, factory farming, bad water, enclosure. Okay, They know they're going to be killed, not in a normal habitat, not close to each other. They're too social distanced. Environment abuse. Okay, keep it coming because I've been told. Offspring removed from them, so they're. I don't know. I haven't been able to speak to these cows. Thank you. Yeah, you haven't asked them. Mad cow disease. They're bored. Okay, keep them coming. I'm going to share the next slide and continue entering into chat. What prompted your initial guesses? So based on the first guess, the visual color, an assumption, okay, the picture, the photo, they don't look sick to me. Life, okay. Memory from the show Yellowstone. Oh, that's a good show. um, My question, capitalism, exploitation, assumptions, we were told. Okay, so see how quick this happened. I showed you a picture, you responded to it, and it came from somewhere. Because our initial assumptions come from somewhere. And you all, I think, mapped on somewhere along maybe one of these bullet points. It could have been previous experience working with cows. It could have been a visual assumption based on what you could see, media, mad cow. It could have been a personal, what we call an anthropomorphic reaction. We humanize these cows. They've been separated from their offspring. They are not close together. They could be depressed. Or some folks said, well, you just told me, so I kind of led you to believe this. Okay, so we had emotional reactions. Because what if I showed you this? This is a fuller frame. How might your reactions shift? Maybe they don't, right? And you can feel free to enter into to chat if anything changed for you. Yeah, shifts big time. Hypothesis confirmed. So I want to share a little bit. I've used this exercise or this picture before, and I used to title this slide the full frame, and it was a participant who said, "Are you sure that's the full frame?" So now what we see is we have this big factory emitting some sort of pollutant. We don't know what kind of pollutant, but there still might be more in the frame that we don't see. And so now it's the fuller frame. So we get a little bit of more evidence, or we get a little bit more experience of what the cows might be experiencing. But still, it's not the fullest frame. And so multicultural orientation highlights this idea that every interaction is a new interaction, and it's just a thin slice of something more. And so earlier, when I invited you to reflect upon someone you thought you knew really, really well, and then learn something new, and then maybe that shifted the way that you interacted with that person, what you felt about that person, how it might have shifted your relationship. And knowing that we don't always have the full picture, and as behavioral health providers, what does that mean? And from a multiculturally oriented perspective, what does that mean? What it means is that we can't always address what we don't notice. And so it takes a lot of energy and commitment. And we can't address what we don't want to notice. And lots of research tells us this, that many of us, most of you, I will assume, entered into this field with great intentions of being culturally humble, of being aware, of being committed to becoming more conscious of our biases. And as human beings, it's just hard, the way in which our brains work, and the ways in which our sort of day-to-day reality is that we don't always have opportunities to notice, or we don't practice noticing. And some of the research, the training that we receive, hopefully maybe today something lands with you, is that there is so much going on that we need to pay attention to. And so I just want to highlight a few recent studies that talk about psychotherapy and racism. And so a recent meta-analysis by Price et al. Indicated that states with higher anti-Black racism was associated with lower effectiveness of psychotherapy for Black youth. There's a group, Williams et al. At Harvard, they looked at the mental health reports of African American clients and showed that, not clients, actually just regular citizens, and they show that the data, when folks learned, when African American men in particular learned about the shooting of an unarmed Black man, that that the mental health of African Americans in that state was adversely affected for 3 months. So that collective trauma with regard to anti-Black racism. And racial ethnic microaggressions in therapy, this is a study that Dr. Jesse Owen and I conducted a little while ago, indicated that racial ethnic minoritized clients, of the 120 in which we were able to survey, over half of them had experienced a racial or ethnic microaggression in therapy. And then of those folks, 76% indicated that the microaggression had not been addressed. And then as well as with diagnosis and over or misdiagnosis of African American patients with schizophrenia, rather than looking at sort of mood disorders. So we can't address what we don't want to or we don't notice. How do we consider the fuller frame? So questions to sit with. And another important piece around our day-to-day interactions with our clients is that authentic cultural conversations matter. So a study that Dr. Joanna Drenane led revealed that when clients withhold salient aspects of their cultural identities, so this is consciously withholding what she terms cultural concealment, their outcomes in psychotherapy are worse than those clients who feel like they can share their full cultural selves. So it's a pretty big, I think, finding and many of you are nodding your head saying, yep, I've been that client, or yep, I've been in that situation where I didn't know what would have been helpful to know with my patient about who they are. So we are now going to build our MCO muscles. We're going to do a little bit of practice. There's so much for us to sort of take in. You have, many of you are experts and have been in trainings like these before. And for me, sometimes just taking 3 questions, distilling it down to 3 questions to help us to practice, to get warmed up around building our multicultural orientation muscles. And these 3 questions, and I'm going to be reiterating these again and again, so you'll see it again, are: what did you notice? What are you curious about? And what might be influencing your curiosities? What did you notice? What are you curious about? And what might be influencing your curiosities? So hold on to that. And how we notice what we're curious about and what might be influencing our curiosities come from our cultural frames of reference. So here are a few of them. They're not all listed here, but things like sexual orientation, ability, social class, or mental health, physical size, gender, race. So these are some of our cultural frames of reference that influence what we notice, influence what we're curious about, influence how we interact. Another way to look at this, because we are not boxes that are discrete little, boxes, we are really fluid and we operate in different systems. And depending on the system and who we're with, different aspects of our identity move to the foreground, move to the background. And so this visual might land well for others a little bit better, in that we have so many of these identities that shift across contexts and become more or less salient. And one more way, because I'm originally from Hawaii and I never miss a chance to show some sea turtles. Another way to think about how our identities are fluid is that the same turtle in the foreground, maybe identities are more salient, that are lit up, and then in the midground and then background, and they're all there all the time, but they just show up in different ways depending on even how we're feeling that moment at that moment. And I love this quote that Malcolm Gladwell talks about, is that we don't deliberately choose our unconscious attitudes, and we may not even be aware of them. The giant computer that is our unconscious silently crunches all the data it can from the experiences we've had, the people we've met, the lessons we've learned, the books we've read, the movies we've seen, and so on, and it forms an opinion. These cultural frames of reference are constantly shifting and changing because we're different every day from every interaction. So let's put this together. I'm going to introduce you to your client, your patient, named Vance. So here is what you know so far about Vance. Vance is Vietnamese American, identifies as male, bisexual. He's 40 years old. He came to the US at age 6. He lives in San Diego, California. He's diagnosed with ADHD. He's not religious and works in informational technology. So this is what you know about Vance so far. So take a quick kind of glance at some of these demographics. And based on your cultural frames of reference, I'd like you to type in just immediately, what did you notice? What is the first thing you noticed? Okay. Mm-hmm. Thank you. Immigration, thank you. ADHD diagnosis. And I'm going to keep us going here. Based on what you noticed, so if it's his bisexual identity, him being Vietnamese, ADHD with an IT job, what are you curious about? And I won't be able to respond to each of those curiosities, but it's helpful to just put it down, like what you're curious about. So how does the client specifically identify in their own words in the here and now? What does their community look like? What's their family background? I'm curious about their Vietnamese identity, about why he's here, how he looks, the type of stress he endured. Okay. Was he not always religious? And then I'd like you to think to yourself, based on those cultural frames of reference, so those various social identities and intersecting identities that you hold, what might be behind your curiosity? So here is where, we use windows to learn more about someone else, but then we hold a mirror up to ourselves and say, okay, I'm curious about why I'm curious. What about me is influencing that? So to your level of comfort, you might want to, if you can put into chat, like what might be influencing. Thank you. So your own intersection between culture and sexuality, countertransference. Okay, skin color, intersectionality. my own family's journey. Thank you. My own background, what I can personally relate to. Thank you, Jennifer. As being an immigrant who also came to the US at age 6, right? Yeah, the anti-Asian bias that we swim in right now. So keep this coming and sit in that sort of recognition of what might be influencing your curiosities, because we're going to hear a little bit more now from Vance. Vance says, I have felt so lonely lately. And it's more than the social distancing or pandemic, but this hopeless feeling that things will never change. My family lives so far away in Florida, and recently some a-hole told me to go back to my country. I've been in the US since I was 6 years old. By the way, did you know that in this country, people who are not citizens have alien status? Alien. Okay. Now, what did you notice? What are you curious about? And what might be influencing your curiosities? So I'd like you to hold on to those, to think through these questions, and without too much thinking, because when we're sitting across from Vance, we don't have a few minutes to respond. What would you say next? So thinking about the 3 pillars of multicultural orientation, what would you say next? And type your response into chat. Okay, I feel compassion for him. I would express that. So I'm going to invite you all to act as if you are saying this directly. So I'm so sorry that you had that experience, and I admire your resilience. Okay. I'm curious about that you're focusing on what it means to be an alien. Tell me more about that. That must be hard to feel. Yeah. I'm so sorry that happened to you. It's wrong. So as folks are developing what they might say to Vance, I'm just going to highlight a couple of things that I'm noticing that really capture the essence of MCO. And that is, for so many folks who have these experiences, these racist experiences, these marginalized experiences, part of going to therapy, part of seeing a provider is they're seeking validation and they're seeking confirmation. And so many of you are using the words that Vance is using, using the word alien, using the word immigrant, using the words that he is using to identify or to share. And so that can be really validating. And the other piece that I wanted to note is just, it doesn't have to be too long. Someone said, I'm so sorry that happened to you. That's really hard. So one thing around multicultural orientation is that the framework is really asking us to have a cultural focus, because oftentimes, especially within the United States culture, we avoid using the words. We avoid using any terminology that highlights race. And so sometimes we talk around it and say culture, or we say family background. And so what would it feel like for us to name racism, to name, I am, you talked about being Vietnamese. Tell me a little bit about what that means to you. So a lot of the skills that you're utilizing, whether it's a reflection of feeling or open-ended questions or validation, how do we add the cultural focus or underline that cultural focus? So we're going to try the next one again, another one. So now Vance says, sometimes I walk around this city and feel like I have a horn growing out of my head or something. Other times people act like I'm invisible. People don't even see me. At work, people call me the wrong name. There's only one other Asian dude in my office of 25 people, and they get me mixed up with him. And I've worked there for 3 years. Some people assume I don't speak English at stores, at work. Okay, again, let's practice. What did you notice? What are you curious about? What might be influencing your curiosities? And then when you're ready, what would you say next? As if you are speaking directly to Vance. I understand how that can feel lonely for you, almost invalidating to be around others. That is so painful, so isolating. Your frustration and anger is valid. We live in a racist, xenophobic society, so exhausting. Yeah. I really love how you're naming that, just that underlying emotion. I want to kind of highlight an earlier response to Vance, kind of naming the xenophobia, naming the racism, naming the exhaustion behind all that. Dealing with racism is exhausting and not your responsibility. I'm so sorry your workplace is like this. Great. Yeah. Awesome. Yeah. Hyper visible and invisible at the same time. Feeling unseen. Thank you for responding. I know it's sometimes a deer in headlights in the moment to have to respond, and this is what our clients are asking for. What is that? And sometimes if we sit and think too long, I know this from my own experience, is that I start to get into this jargony thing where, and your authentic response is sometimes the most powerful. So thank you. I want to share, and your responses were amazing, and I've had time to think through these as I share some examples, but a couple of examples that, as a therapist, as a provider, we might share that highlight the cultural focus. Name the feeling is something like, I imagine it could feel that there's something wrong with you. There is nothing wrong with you. The interactions at work and how your coworkers get your name wrong, I am so sorry that happens. My ears perked up when you said invisible. Where does that show up for you? Thoughts you have or feelings that emerge? Okay, so that was related to some of the feelings and the invisibility. Here's another example. It makes so much sense to want to belong and seen for who you are. It is so important to be understood as a unique human being. It sounds like you've had experiences where you've been fully known and within your family and within a supportive community. You know what that feels like. I see that as a strength of yours. You recognize how important community and real relationships are in your life. You wish you had that here too. And so with this one, I just wanted to provide an example of how we can go in a different way. And for someone like Vance to be able to say, I feel unseen, I feel invisible, I feel unknown. If we think about it from a strengths-based perspective, it's that he's known the other. He's known the other experience. And so how do we highlight that strength? Like, gosh, you know what it feels like to be fully seen. And you wish you had that here too. So here's just a couple examples. And then the ones you shared really are beautiful. So to close today and maybe leave a little bit of time for questions and conversation. For me, Claudia Rankin's quote here, if you haven't read anything by Claudia Rankin, gosh, she's just brilliant. She has 2 books that I just love called Just Us. And the other is called, oh my gosh, I'm blanking all of a sudden. It's a white cover with a hoodie. She wrote it right after Trayvon Martin's death. But I will remember in a minute. But I want to share a quote from her because I think it really captures the heart of multicultural orientation. She says, well, that really is my ambition. how to have a conversation so that the space can hold discomfort, so that the thing isn't a thing that you have to put over there, so that we can get over ourselves in a sense. And I mean all of us, people of color, white people, that we have suddenly a moment where we have an investment in a kind of possibility that is beyond our negotiation of each other. I think the messiness of just saying what it is when it is. Thank you. All right. Do we have time for a couple questions?
Thank you so much, Dr. Tao. That was a really powerful presentation of the multicultural orientation framework, and particularly just sharing with us how you bring in a cultural humility, cultural opportunity, and cultural comfort, how those all work together. And I feel really privileged to have seen how you just really helped us see how to bring those into the counseling spaces that we go into. So thank you so much.
Thank you.
Right now, we don't have any open questions. I'm trying to see if there's any coming in here. We've got about 2 minutes left. So if anyone does have a burning question, go ahead and throw it in there. But yeah, I trying to get that. I think one thing, the authentic cultural conversations and the ways that we can pay attention to the ways that they come up, not just when somebody says those words, but noticing it within symptoms and within those other places. So far in the Q&As, you're just getting a lot of appreciation. So yeah. And then the only other question we have is, will there be a PowerPoint provided? And I think Chinui posted in the chat earlier, but once we end this, we work on editing all the videos and getting everything, making sure that the slides are accessible. And then usually within about a week, our technology assistant is able to get those up on our website. So there will be the English version, the Spanish translation, the closed caption version, and the PowerPoint will all be up on our IBH Equity website. And also just to encourage everyone, if you want to know immediately when it comes out, you can subscribe to our project's YouTube channel, and then you'll get a notification. That's the way to get an update about it. Let's see. We do have one question for the last 2 minutes. So let's see here. How does your perspective influence the ways you collaborate in setting goals?
Can you say that one more time?
It says, how does your perspective influence the ways you collaborate in setting goals?
With clients, or I don't know, maybe specifically to
yeah, maybe we'll make it about clients.
We can make it about clients. Yeah. One of the things in terms of goal setting is that it's so iterative, and oftentimes in a lot of like fast-paced clinical settings, we're expected to identify those goals right away. And in my mind, and for many of you, maybe the person who asked this, it's like, how am I supposed to come up with a goal when I don't even know the person? Right. And so part of it might even be this sort of statement around, part of our time together is about identifying goals that you would want to work on. And by the time that you leave, that you will have sort of reached certain sort of confidence about being able to kind of work on certain things or have achieved certain things. But let me tell you, I don't think that we can come up with goals right away before we get to know each other a little bit better and how we're going to work. And so we can jot down some draft goals here, and those can change every time we meet. But for the time being, if we need to write some of these things down, what are your initial kind of thoughts about how we want to work together and what you're looking for? And then we'll revisit this again and see whether or not that still lands for you, that still makes sense. So that's one way the collaboration happens. And it's sort of me saying, hey, this is not this linear sort of space. We are not linear people in general. Yeah,
I think closing on "we are not linear people in general" seems like a really good idea to me. So there were a couple more questions that came in later, but you all have Dr. Tao's contact information. If you wanted to reach out to her, you're welcome to do so. And we really, again, thank you so much. This was a really wonderful webinar that you provided. I feel like we all learned so much from you, and we're very appreciative of your time and sharing your wisdom with us today.
My pleasure. Be well, everyone. Take good care.
Bye.